Hi everyone, thanks for joining us this afternoon. We've got quite a busy session for you today. So I'll just go through the agenda. We'll do welcome and introductions. I'll hand you over to Barry, who'll give you an overview of the key messages this week. And we have an update from Slavek from the Association for Polish Families. Then, as usual, we'll go into Champions Corner. And this is an opportunity, champions, to raise any questions, comments, suggestions, and it's led by you. So if there's anything you think you'd like to raise, please use this opportunity. You can also use the chat box throughout the session as well. Our workshop theme today is mental health and well-being, and we have Debbie and Laura joining us from Merton Uplift, who are going to give us a great presentation on the work that Merton Uplift are doing, and in the context of COVID as well. We'll also have time for questions and discussion, some next steps, and we'll finish by 1. So welcome to any new champions joining us today. I think we have a couple on the call. Thank you for joining us. If you could just take a minute, everyone, to introduce yourself in the chat box. And as I mentioned earlier, use the chat box throughout the session to ask any questions or raise any points. Just a little bit of housekeeping. You can have your camera on or off. That's completely up to you. But we ask that you do just mute your microphone when you're not speaking to make sure that we can hear the person who is and there's no feedback. And I'm going to hand you over to Barry, who's going to go through the key messages.
Thank you, Una. Hello, champions. Thank you for joining us again this week. Positive news again this week, champions, that the 7-day rate is continuing to go down. The rates are coming down within Merton and across London, but they are still high. So the 7-day rate has decreased to 289 per 100,000 residents. And what that really means, champions, just before Christmas, we were seeing about just under 400 new cases every single day in Merton. So today's line list shows about 45 in the 40s. So you can see that the cases are reducing well within the borough, but they are still high. And so that 7-day rate, fortunately, is decreasing in the over 60s as well. Again, positive news, but that admissions are also coming down very slowly. And that's positive news, but the NHS is still under significant pressure. There are large numbers of people in hospital and in intensive care across southwest London. So key message is to stay home and continue to protect the NHS. We have seen in the most recent reporting period another 43 of our residents within Merton who have died due to COVID-19. And so that's just that indicator that shows this sad number of cases of people that are very unwell from COVID. And so we need to continue to protect the NHS. I've just before the meeting looked at the latest data, and that the most recent reporting period has gone down to 28. So there are hopefully signs that this wave is coming to a close. But champions, we need to continue our efforts. It's been incredibly difficult, but we need to continue that to protect the NHS and our communities within Merton. Again, testing rates are reducing. So is positivity, which is a good sign. But anybody with symptoms, you hear me say this every week, even mild, if you're not too sure, then please self-isolate immediately and seek a test from the NHS website or calling 119. And again, we're seeing some really positive uptake. So thank you very much to our frontline staff, our carers and our volunteers who are continuing to take part in regular asymptomatic testing. So these are the lateral flow devices that we are running across the borough. So we would encourage those groups, frontline staff, carers and volunteers, to continue to take part in regular testing. So that's twice a week. And you can book via the Merton Council website. We've got modern assembly halls. We've got a good network of community pharmacies. So thank you for supporting that, and please continue to do so. Vaccination rollout is continuing, and there are increasingly a number of webinars developed by our NHS colleagues. And I know that Ben Aman is probably on the call. There was another fantastic webinar on Sunday evening where I think there was 80 or 90 residents and workers taking part and really posing those questions about vaccinations to our clinicians. So we will make sure that you've got the dates and the times of those going forward, because again, I think there's going to be a really important role for our network of community champions to support that vaccination rollout, including those key messages. Last key message from me is around enhanced testing in Pollard's Hill. So I spoke about this last week. And so if you remember, last Sunday evening, we were contacted by the national government to say that there has been one isolated case of the South African variant within the CR4 postcode. So we set up a enhanced testing program in Pollard's Hill to track any community spread and to restrict any further transmission. So we're encouraging all over 16s who live, work or visit Pollard's Hill for essential reasons, such as a childcare bubble, to get a one-off asymptomatic PCR test. As of the evening of the 8th of Feb, what I can say is that 1,300 tests have been booked at the mobile testing unit, which is fantastic. And we've also received back 2,392 tests at Commonside, the New Horizons Centre, which is great. And again, we're pushing the last few days. We are continuing to knock those doors within the Pollard's Hill area and on the fringes to encourage uptake of that one-off asymptomatic PCR test. But thank you again for supporting the messages in the community. Champions, I've seen the WhatsApps, I've seen the emails. We really do appreciate your support on that enhanced testing program, which you will have seen in the news is increasing in a number of other places across the country in response to the surveillance of variants. So I will stop there and hand back to Una, and I'll pick up any questions in Champions Corner and or in the chat. Thank you.
Thanks, Barry. I'm going to hand over now to Slavek, who's going to give us an update on the work that's going on at the Association for Polish Families. And as Barry mentioned, if you have any questions about the key messages, please do put them in the chat box or raise them in Champions Corner. Over to you, Slavek.
Thank you, Una. Before I start, I will go through some of the background information on our organization. We work in Merton since 2007, supporting Poles and Eastern European across the borough. During the COVID pandemic, we are unable to provide some of the face-to-face services as probably as everyone else. So most of the group sessions are postponed. Saying that we keep running some of the main services for our community, and that includes the information and guidance for Poles in Eastern Europeans. It's open 5 days a week, 9 to 5 over the phone or video calls. We work with Home Office directly on the EU settlement scheme. And I will encourage everyone to send any Europeans our way. The deadline is fast approaching, and they need to go through the scheme. There is no other option. And also we work with Debbie with Merton Uplift. We're running mental health well-being workshops in Polish for a Polish community. Around stress management, relaxations, and so on, to ease the stresses and challenges over the COVID period. Poles are still the largest minority group in Merton. In terms of population, we reaching almost 15%, which is just shy of 22,000. So it is quite big. Most of the Poles are in working age, between 20 to 25 years, and again, most of them, 70-80% are self-employed in construction, catering, and social care. In terms of COVID and challenges we faced, the community faced, Economically and socially, Poles suffering same issues as before the pandemic, which is the families living in overcrowded accommodation or low-income household who experienced poverty before the pandemic. Uh, Further contributing factors to the financial hardship is that families we support and in employment are mainly in low skilled positions, where the exposure to work and different households cannot be avoided. They work cannot be done remotely from home. So that's the biggest factor in across the Polish community. The implications from COVID for Poles becomes even clearer when you consider that half of the population in Merton are struggling with accessing appropriate services, mainstream services. It's mainly due to language barrier and inability to explain the issues, needs, and challenges they're facing, as well as getting the complex guidance from the mainstream services, which they may not understand or take difficulty to obtain and take action. So those challenges are progressing the difficulties and even more. So key findings over the last 10 months, a year, almost a year. Income loss has rapidly worsened financial position across the families on low income, um, and it has huge impact on food insecurity. As organization, we from the end of February last year, we part of the community fridge network, and we provide between 60 to 100 food boxes a week in the last 12 months. So that's the picture how the low income families were affected. Saying from the food insecurity, we've seen quite a big risk in obesity. Um, Families mostly survive on canned food and carbohydrates like pasta, rice, so on. So there would be probably issue of weight, gaining weight and also obesity in the near future, not just across probably the Polish community, but everyone else, especially now when the takeaways are quite easily accessible and people taking the advantage of it. And one of the key finding was, as I said previously, access to the services. Um, the knowledge of available services is not there. Poles and Eastern Europeans, they do not know about those services. They don't know that the help is available, and that even further increases the suffering of those families. Um, so I'm conscious about the time. I know that the agenda is pretty busy, so I think that would be me. If there is any questions, I'm happy to answer them in a champion's corner, I would say. Una, over to you.
Thank you, Slavek. It's Barry. That's really helpful and fantastic to hear about the amazing work that the Association for Polish Families are doing. We're working with Slavek on a number of things, and is it next Monday, Slavek? We're doing a specific session with Polish and Eastern European communities around vaccine barriers. So really delighted to be again working with Slavek on this. I think there was a hand up, but now it's gone down. Una, are you back?
Hi everyone, can you hear me?
Yeah, we can hear you.
Sorry about that. Yeah, I'm back. Thanks for holding the fort there, Barry. Right, are we on to Champions Corner?
Barry,
Hey, Vasa.
yeah, can I actually thank Slovak, please? Because I really love the end Slovak. I'm a local GP, and I have I do look after a few people from Poland and other parts of Europe. And for Christmas, they always give me a chocolate with a plum in the middle. That's my favorite Christmas present. So I get on very well with my patients from Poland and other parts of Europe too. Just want to say thank you. The best bit for me, Slovak, was the end where you did not stop at COVID. You also went into well-being and obesity, because you know what? COVID is consuming all our energies now, but certainly we'll win this fight. And then there's life after COVID. There's more to life than COVID. And when we get there, Slovak, I'll be tracking you down, because the well-being of all communities, including the Polish community, is dear to my heart. And we need to look into the well-being of the Polish community with view to cardiovascular disease, with obesity, with fatty liver, with diabetes, you name it, I'll be on your case. So the bridges we are building now because of COVID with all the champions, all of you, I have to work with you for non-COVID related health and well-being matters when we overcome this hurdle of ours. So Barry has got your names, I got you marked, so we will meet again.
Thank you so much. Thank you so much, Basa.
Thank you, Vasa. And thank you, Slavek. Sorry I dropped out there. Andrew, you had a question during the week about the vaccine, and since we have Vasa here, it's a good opportunity to get the information directly from the expert. Would you like to ask your question?
Thank you, Una. I can't remember which one it is. I was just gathering together some questions from our members.
Andrew,
Yeah.
your question was a member of staff has declined the vaccination because they have already had COVID-19 and think they have immunity.
That's exactly it, Barry. Thank you. Thanks.
Very good question, Andrew. Very commonly asked question, and I love questions because all questions have answers. So the thing is, yes, if you had COVID-19, if you're unfortunate to have met the virus and had COVID-19, yes, your body would have produced antibodies. The problem is how much and how long will they last for is the million-dollar question. Statistically, if you look at cohorts, we could say 6 months, some people say even 8 months. But the problem is, it's not about cohorts, it's about yourself. Are you safe? The answer is a resounding no. No one is going to say you are safe just because you met COVID-19 before. Therefore, after a month has passed, you can get the vaccine. Now, the reason I'm so confident about it is that all my friends, medical colleagues of mine, who met COVID in April, May, and June, all of them rushed in December when the vaccine came out. And you know what they told me? Basa, once is enough. I don't want it a second time round. And they could not be certain that the first occasion, the first time they met the virus was enough for them. They queued up to get it. They'll get the vaccine moment it arrived, because they know from their I talk theory. I don't have lived experience of symptomatic COVID. Therefore, the friends of mine who had symptomatic COVID, not one of them declined. To me, that is the answer. The science is science, but in real life, the lived experience of my colleagues inform me more. And the very fact that all of them said, once is enough, I don't want a chance of second COVID infection, let me have the vaccine, and they all had it. That reassures me much more than any book can.
Oh, thanks so much. I really appreciate that. Thank
You're
you
welcome.
so much for that.
Thanks, Andrew. Thanks, Vasa.
Thanks, Una.
Does anyone have any questions? I'm just looking in the chat box.
Una, you know I come to disrupt your meetings. There's a question there. There's a question there which says, what are you doing to counter the fake news? Well, to counter the alternative facts, we have loads of engagement meetings which Barry and Una and Ben and Aman from the CCG and others organize. Please let us know if you think there is a group of people. There are a group of people who we need to talk to. Just give the names to Barry and Una. I got a gang of clinicians who are ready, pharmacists, nurses, doctors, ever ready to pitch up, even on Saturdays, even on Sundays. Barry has met me on a few Sundays on this show. We are ever willing to go wherever we need to go, whatever it takes. We want the country back again. We can't give it up to COVID. So we will go to any group you find for us, 5 people, 50 people, 120 people, doesn't matter. We have done small groups and large groups. We are willing to take it on. We come from the side of science, from the side of facts. We come from the side of population health, for the nation's future, our children's future. So that's what motivates us. So we are ever willing. Just let us know.
Thanks, Vasa. Also, can I say that the champions are very proactive in sharing this information. And yesterday, there was a message going around. I think that's what Una was referring to in your chat about vaccinations in St. George's at last minute due to snow. And the champions sent it in to us. We verified it wasn't true, and they were able to go back to their networks and pass the message on. So thank you all to the champions who are in the group chat, who are doing great work. Do we have any more questions or any comments? Before we move on, thank you all for working so hard, sharing the key messages, and increasing their reach as well. If anyone who has had the vaccine would like to volunteer to be a bit of a case study for us, and we perhaps in my Merton, we'd be able to put your picture and your experience of getting the vaccine, or anyone who's got an appointment in the next few weeks as well, who would like to do the same, please do get in touch. And it's great to see the champions getting involved with the vaccination rollout and helping spread the key messages. So thank you all. If we've no other questions, we'll move on. I'll hand over to Debbie and Laura, who've kindly joined us today. We've had lots of questions and comments, and we've discussed mental health over the last few months and the impact that COVID has had. So I'm really delighted to see Laura and Debbie here today to talk to us about Merton Uplift. I'll hand over to Debbie and Laura. Who wants to start us off? Oh, Debbie, you're on mute.
As ever, I live on mute. Laura, I'll hand to you if that's okay for the first instance.
Yep, sure.
Thank you.
Hi, everyone. My name is Laura Baird. I'm one of the Deputy Clinical Leads for South West London and St George's IAP services. And yes, we're here today to talk to you about Merton Uplift. Debbie, I don't know if you just want to introduce yourself before we go through the presentation.
Afternoon, I'm Debbie Davis and I'm the Service Manager for Merton Uplift.
Una, I've got my presentation. What's best to...
I can just go through it with you.
Brilliant, that would be great, yeah.
And I'll just let me know when you want me to change the slides.
Okay. I think I can't see it up on the screen.
I've got the brief presentation overview. Can anyone else see that?
Yeah, that's what I can see.
Okay, I wonder why I can't.
I can see that. So if we talk to you about our service, I apologise, we're having a couple of difficulties here.
Okay, I've got it now. I don't know why it wasn't clicking through.
Thank you for saving me, Laura.
So we just wanted to start with just a brief introduction to what Merton Uplift is, run through the key elements that make up the service, and then go through a bit more detailed information about the 3 different parts of Merton Uplift, finishing with a bit more about what we're doing in this time of COVID, and then there'll be some time for some questions at the end, if there are any. So, in terms of an introduction, Merton Uplift provides free and confidential talking therapies, as well as wellbeing and employment support to anyone who is aged 18 or older, who lives in Merton or has a GP in the borough. So you can live in one of the other boroughs, but as long as your GP is in Merton, then we will still see you. We can help with a wide variety of issues, so anxiety and stress, depression, eating problems, bereavement and loss, sleep difficulties, anger issues, obsessive compulsive behaviours, and also psychological trauma. We provide evidence-based psychological therapies. So these are therapies that have been approved by NICE, the National Institute for Health and Care Excellence. And these therapies include things like cognitive behavioural therapy, interpersonal therapy, and dynamic interpersonal therapy. We're open 8 AM to 8 PM Monday to Friday. So we offer appointments in the morning or the afternoon and also in the evening. Due to COVID, which I'll go into a bit further on in the presentation, support and treatment is mostly being delivered online via video call. We use a program called Attend Anywhere or telephone rather than face-to-face, but we are also still offering some face-to-face appointments as well if people really need them. In terms of referral, people can self-refer either by calling the service or via the Merton Uplift website. I think around 70% of our referrals are now self-referrals, or GPs or any health professional working with somebody can refer them to us as well. And I have the contact details at the end of the presentation for you. Once someone's been referred, the person will be called by one of our admin team. This is usually within 2 days of us getting the referral, and they will be booked in for a telephone assessment. And that can usually take place within a week. It depends slightly when we have slots available, but sometimes it can even be the next day or the day after. So this telephone assessment, it takes around 45 minutes, and it's really to help us to understand what the person's needs are, and for us then to have a think about what the most appropriate treatment or support might be. And the person will be asked to complete a few questionnaires in advance of the assessment so that these can be gone through. If an interpreter is needed, then the service will arrange this, so people don't have to find their own interpreters or use family members. We will arrange an interpreter if it's needed. So there are 3 key elements to Merton Uplift. We have the IAPT, Improving Access to Psychological Therapies, bit of the service. We have a Wellbeing service, and we have the PCRS, the Primary Care Recovery Service. So as I explained, people who are referred to Merton Uplift are assessed via telephone. Sometimes this is face-to-face, but less so particularly during COVID. And following this assessment, each person will then be offered support from the most suitable part of the service depending on what their needs are. So we have our Wellbeing service, which offer a range of wellbeing support options, including workshops, courses, and wellbeing navigation. We have the IAPT service, which offers psychological therapy for depression, anxiety difficulties, and this can be in groups, one-to-one support, and also digital therapy support. And then we have the Primary Care Recovery Service, which offers support for individuals who have more complex and severe depression or anxiety difficulties, and also people who have stable psychosis or bipolar disorder. So to talk a bit more about the IAPT bit of the service, so as I've said, we offer psychological therapy for a wide range of difficulties, and we operate, as all IAPT services do, in what we call a stepped care model. So the idea is that you offer somebody the least disruptive, least time-consuming intervention appropriate for what they need. So we have step 2 treatments, and these are psychoeducational groups for low mood, for worry, for panic and phobias, and also stress management. We have guided self-help, which is an individual intervention where somebody's provided with self-help materials, and then they have regular check-ins with one of our graduate mental health workers. And these check-ins can be either telephone, video call, or face-to-face. And then we also have an online option, which is with one of our partners, Silver Cloud. And this is effectively a kind of online guided self-help. So the information is all available online, and the check-ins again occur with one of our graduate mental health workers. The other step of treatments we offer in IAPT is step 3, and these are more intense treatments. We have cognitive behavioural therapy groups. At the moment, that's only for depression. But we predominantly offer individual therapies at this step. So cognitive behavioural therapy, IPT, EMDR, which is a trauma treatment, behavioural couples therapy, and psychodynamic counselling. Again, these treatments are provided face-to-face or video call. And we also have an online CBT offer through one of our partners, IESO, which is kind of it's like an instant messaging format, I suppose. Alongside that, people who are accessing IAPT can also access some employment support. So we have some dedicated employment workers who work with people both one-to-one and through workshops to try to either resolve issues at work that might be contributing to their low mood or their anxiety, but also to support them into work. As you might imagine, with COVID at the moment and the situation that many businesses are in, that's proving quite challenging. Our primary care recovery service is for people with more complex and enduring difficulties, and that team is made up, it's a multidisciplinary team. We have a consultant psychiatrist, psychologists, and also community psychiatric nurses. This team offers medication reviews, psychological support, again, which can be individually or in a group, and then also some recovery support for people who have stable psychosis or bipolar disorder. Do you want to talk a bit about the Wellbeing team, Debbie, or? Yeah.
Yes, of course. So the Wellbeing service sits alongside the service provision that's clinical in terms of therapy and treatment, and it's able to reach out and give people opportunities to engage either through Eventbrite or through a referral into the service, workshops and support that help you help yourself. And so within that, there are self-care modules around relaxation, around improving your sleep hygiene, around managing your anger and your irritability, and around setting goals and thinking about your potential and your life and career aims. So in tandem with therapy, they can work really closely together to help support you work towards employment that you want, to help support you to work towards improving your whole life around thinking about the things that you did before you started experiencing elements of stress or anxiety or depression. So if you used to go to the gym a lot, then it might be thinking with you about how we get you back into the gym and what that might mean for you in terms of your well-being. But also they've started to deliver some groups alongside with our recovery college partners. So if you've had a secondary care input, we can work with you through that programme as well. Our employment coaches work quite specifically to either help you think about returning to employment if you're not currently working, and if it's possible to help you think about retaining your job and putting in reasonable adjustments if that might be needed whilst you're struggling with your employer. So we will work with you towards that if we possibly can. At the moment, because of COVID, nearly all of the support is via either video link, Teams, or using Eventbrite in terms of seminars.
Sorry.
It's all right.
Are we on the right slide?
Yeah, no, that's fine, Una. So we're working at the moment delivering the range of courses that we've spoken about earlier, including the anxiety, etc., etc. And we're about to start doing a piece of work with our therapy teams to increase the therapeutic element of that, so that can help support people getting early interventions almost as soon as you recognise there is a difficulty or a problem that's not something you can overcome by yourself. And some of the things that are really easy to put in place are things around helping you manage sleep. Inherently, that's difficult. I'll put my hand up as a poor sleeper, and I've utilised some of those skills, and they've made a significant improvement to my sleep. So I also think well-being is about how you manage your relationships with your friends and your family and the people that are around you. And so our well-being coaches will do a piece of work with you about thinking about those relationships and thinking about how you might improve those for yourself and for the way that people receive them, the relationship from you. Can we move on to the next slide, Luna?
Sorry, I can't see which slide you're on.
We're
it
still on the well-being slide, Luna. Can we move forward? Sorry.
COVID-19.
And now we're on to COVID, Laura. Sorry,
okay,
I apologise.
Yeah, that's all right. So I'll talk about that. So there's a couple of things that we've started offering specifically since COVID entered our lives a year ago. The first is that we are now offering a new intervention called psychological first aid. Well, it's not new, it's new to us. It isn't something that we offered before. And this is support for NHS frontline social care and care home staff. And it is a step 2 intervention, so it's guided one-to-one support. And this again is an evidence-based treatment. This was developed by the World Health Organization with the idea of supporting frontline workers during a crisis and in the immediate aftermath of a disaster. So it's designed to help people who are on the front line to maintain their well-being and their psychological resilience whilst they're working through a crisis. So it is trying to support people to feel calm, to stay closely connected to the people in their network that can support them, to foster their coping abilities and also help to build their resilience. And very much the ethos is that it's not that that person has a mental health problem, it's that they're probably coping extraordinarily well with a very difficult situation. So we just need to tap in to what they've already got and bolster that, really. Secondly, we can also provide bereavement support for people who've lost loved ones through COVID. We have a bereavement counselling offer, and we can also provide cognitive behavioural therapy for people who have experienced a traumatic bereavement and may be experiencing symptoms of trauma as a result of that. So these interventions should help somebody kind of make sense of their feelings and grieve their loss, and be able to start accepting the loss and moving forward with their life. And we also wanted to make particular mention of the work that we do with people with long-term health conditions. We always work with people with long-term health conditions, but we're aware that probably the last year has been particularly challenging for people with underlying health problems who may have been shielding for long periods of time, feeling particularly anxious about whether they might catch COVID or not. So I just wanted to highlight that we do have we have specially trained clinicians in our IAP team who will provide psychological assessment and therapies to people who are affected by long-term health conditions. We have a specific long-term conditions lead who looks after this bit of the service, and that we are still open to see people, and if people are worried and anxious about leaving their homes, that we can obviously still do this work over the phone or via video link. So people don't need to feel cut off and as though they can't access us just because they're shielding or they can't leave their house. And actually, if we can help them think about some of the barriers that they might be experiencing and how to overcome these, then perhaps we can help contribute to an improvement in both their physical and their emotional health in the longer term. So I suppose lastly, how do you access Merton Uplift? There, 0203 513 5888. And if you call that number and leave a message, if our admin team aren't able to pick up the phone, they will call you back and register the referral and book you in for one of those initial assessments that I mentioned. Alternatively, people can complete a self-referral form on our service website, and the address is there. And there are also professional referral forms on that website, which can be downloaded, completed, and then emailed to us or posted to us. But email is probably the most efficient, particularly at the moment. And if you've got any queries about a referral or anything, you can see there's our service nhs.net email there at the bottom. And yeah, I think that's it. Thank you for listening. Does anyone have any questions they'd like to ask? I paused the chat so I didn't get distracted.
We have a couple of hands up, and then we've got some questions in the chat box as well. But Emma, you have your hand up.
Oh, hello there. I was just going to ask about waiting times and waiting list following the telephone assessment.
Yeah, so that varies significantly depending on what type of intervention the person is offered. So, for example, our step 2 interventions, people can often be booked into those almost straight away, and those will take place within 4 to 6 weeks. Our step 3 interventions in IAPT at the moment, the waiting time is around 16 weeks. And in PCRS, the waiting times for psychological intervention for those more complex cases are a lot longer. So I'd say a minimum of 8 months for that, unfortunately. But yeah, and again, wellbeing, people can often be booked straight into those.
Thank you.
Thanks, Emma. Logie, your hand is up.
2 questions. One is, at the current pandemic, what's the take-up rate at the moment? And you just said 6 weeks, a long time for somebody doing crisis, isn't it? I mean, to wait that long. I mean, anything can happen to people if we wait that long. I mean, it's quite dangerous, really.
So in terms of we haven't had a significant, I think in the lockdown last year, the number of people accessing the service decreased quite a lot. And it then kind of over the summer went back up to sort of the usual levels. We've had a bit of a drop again in January, which we think again is due to the lockdown coming back into play. But so overall, we're slightly down on our usual referral numbers, but it's just about staying where it is. We haven't had a massive surge in referrals, which I think is what we maybe expected might happen, because you know, some people are really struggling with how things have been at the moment. As you say, 6 weeks is a long time to wait if you're in crisis. I think it's worth highlighting that we're not a crisis service, unfortunately, which is why there is a bit of a wait for treatments. But what we can do is if somebody comes into the service and can get assessed within a couple of days, then we can, if we're not the service for them, if they are in crisis and they're not able to wait 6 weeks, then we would be able to identify the service that can take them on and support them, and we would make that referral across.
Thanks, Laura. Logie, you're on mute.
When somebody complain about so much of people need mental health, and when you say your referrals no good, so where those people are going to help then? Really, I'm a bit lost there. Because every time you hear people have got mental health issues, and so where the help is going if your reference not that much? I'm so surprised. We are expecting Merton must have a very lot of referrals from Merton anyway. So I'm wondering where the help going then? Who's giving the help to them at the moment?
So Logie, as Laura said, if people present to us and they have a crisis, we can move them to the correct part of the pathway where they can be seen in crisis very, very quickly where that's needed. But where people ring in and they get to a point whereby they've had an assessment with us, they are sent crisis information. So if things deteriorate in the interim, they know how to access crisis lines. and how to get some support within that framework. And I think if we think about a London-wide picture and indeed a national picture, Merton performs very well in terms of wait times. It's not ideal. We would like to see people much faster. But I think
Thank you.
we have about 750 referrals a month into our service, and all of those are processed really very quickly to try and get the majority of people treatment as soon as possible.
Thanks, Debbie. Vasa, I see your hand is up as well. Can I bring you into this?
Yeah, sorry, you know the button once again. During COVID times, we had an excellent crisis intervention service called the Orchard or Orchid, I think it's called. I think we need to highlight that. They did a brilliant job, and I think the GPs know about it. But I think if need to Barry, we probably have to share how that crisis intervention center works, because I was quite reassured by that. I thought it was brilliant.
Thank you, Vasa. Yeah, we'll pick up that and we'll get it shared with the champions as well. That's a really good idea and it's really important. Thank you, Vasa.
Yes, because Orchid is still running. It's still open. Yeah.
Long may that continue.
Yes.
Thank you, Logie, Laura, Debbie, and Vasa. Just looking in the chat box, Lisa, you had a question. Do you want to come off mute and ask it? Lisa, are you there? So Lisa's question was, let me find it. Do you know if the Recovery College have increased their referral pathways? Pre-COVID, you had to be known to psychiatric services to access them.
I don't know the answer to that question, Debbie. Do you?
I don't conclusively. I do know that our wellbeing team have done a lot of work alongside the Recovery College. So if there is a gap in provision from the Recovery College, I would hope that our wellbeing service can pick that up, or our partners in other areas of the community.
Thank you. Chris, I see your hand is up. You're on mute, Chris.
Right, here I am. Yeah, Chris Larkman. I run in Rains Park a bereavement service, the Rains Park Bereavement Service, which is very successful. And we've got a group of trained volunteers who meet regularly with people who are bereaved. And we get quite a lot of referrals from Merton Uplift. And yeah, I can't understand why we're doing that if you yourselves cover bereavement.
So I think it might, I mean, I guess we might do maybe if somebody was requesting group support, because we don't have a bereavement group intervention, we offer just individual interventions. I think it might also be that I guess we would perhaps be offering interventions to people who have more kind of complex or complicated bereavement responses. I think if somebody presented to us who had a recent bereavement and we felt that that response was quite appropriate and normal, that we wouldn't necessarily then want to intervene with a psychological intervention. But perhaps if we felt that what they might benefit from is a bit of support and understanding about what's going on for them, that maybe we would then be signposting them to you. I mean, it would be useful to understand. I suppose that's just a guess on my part, but
That's helpful, and it'd be useful actually if you and I had a chat or an email afterwards over this separately.
sure. Yeah, that sounds good.
If you could send me your email address, perhaps in the chat box, that'd be great.
Yeah.
Thanks.
Both in touch after the email. I'll send you both an introductory email.
Thank you.
Thank you.
No problem. Eleanor, you had a question in the chat box. Would you like to come off mute and ask Debbie and Laura?
Yeah, sure. I'm really sorry if you covered this already, but I just wanted to check if the Merton Uplift and the Wellbeing service is for Merton staff as well as residents. It's only because we have a staff newsletter, and I was going to highlight it when I realised that lots of the staff might not live in Merton.
Hi, Eleanor. Yes, the service we provide through Wellbeing is ideally for residents or people with a GP in Merton. I do know our outreach exceeds those boundaries, and within the Wellbeing service itself, that is not necessarily problematic. In order to have treatment, we would then, if you weren't eligible for treatment, if there was psychological treatment that was deemed to be in your best interests, if we couldn't treat you, we would make sure that you were referred to the appropriate service in the area you live.
Oh,
anything I missed there, Laura, that you'd like to add?
I think that's right.
That's perfect. Thank you so much.
Pleasure.
Thank you. Emma, you had a question. Would you like to come off mute and ask it to Laura and Debbie?
Yeah, sorry, I think you did touch on it earlier. It's about if you are offering face-to-face during lockdown.
Yes, we are. So for particular groups of people, so people who perhaps have a learning disability, who would really struggle to use the digital sort of means that we're providing therapy through. If people just don't have any digital access, so wouldn't be able to access it that way. If somebody doesn't have a safe space, so for example, perhaps they're in a domestically violent relationship and it just wouldn't be safe for them to be having sessions in their home, or if you know, they're living in an environment where you just couldn't have you know, a private therapy session in a room. So perhaps you're sharing a very small house with a large number of people, for example, then we can still offer face-to-face in those circumstances.
Okay, thank you. I can see Jackie's asked about the waiting list as well, and actually I've forgotten how you differentiated the wait times for each service. Is that okay to go through them again quickly?
Yep, so it really depends on the type of intervention that is decided upon as being the most appropriate. So for our step 2 interventions, those are often people can often be booked into those straight away, so it's kind of a 4 to 6 week wait. Our individual therapies at step 3, it's around a 4-month wait, and our primary care recovery service for the more complex difficulties, those waiting times to see a psychologist are much longer. It's sort of up to 8 months, something like that.
Thank you.
Una, you're on mute.
I'll never get used to this.
Me neither.
Thank you. Thanks for that question, Emma, and Laura for answering. Jackie, I've seen you've just asked a question. Would you like to come off mute and ask it to Debbie and Laura?
Hello.
Hi.
Hi there. Yeah, I just wondered whether, sort of due to the circumstances of COVID, the psychological services are quite likely to increase. So are there any proposals to increase the available appointments for that, to take down sort of the deluge that you're likely to get, or is we don't know yet?
I mean, I think it's interesting because we've been expecting a deluge for the past year and it's not happened yet. And that's not just in our service, that's across sort of services over the country. So whilst we're keeping an eye on the referrals and what's happening, we haven't experienced that deluge as yet. I think what we would do is we work with a number of partners. We work with an organisation called ICS, and I think what we would do is enlist their support if we suddenly did get a huge sort of deluge of referrals within a few weeks to help us manage that.
Oh, okay. Thank you. Thank you.
Thanks, Jackie. Barry, I see your hand is up.
Yeah, thank you, Una. Laura, it was fantastic to see in your presentation about the 5 ways to wellness. Could you give us a recap on those kind of 5? Because my understanding is that they are evidence-based ways to keep mentally well.
Sorry, my computer is freezing.
Sorry, I can cover it because we use it in our public
Yeah,
health services too, around those key prevention things on how we can keep well. So just a reminder to those champions, I know we've spoken about these before, about the 5 ways to wellness, are real evidence-based things to keep us well. So that fantastic graphic at the bottom there. So to connect with people, to maintain those links. And I think these sessions also, I know some of our champions have said to us before, during lockdown and shielding people, sorry, our residents that are shielding, sometimes these webinars are how to connect with other people. Being physically active is good for our physical and mental well-being. It also helps us to get outside and connect with the community. Taking notice, so not always having a screen in front of you. Give all of our champions are volunteers. We've got 150, I think it is, Una, now. Of people that are giving their time to support other people, looking after their neighbours. It's incredibly cold and horrible out there right now, so looking after our neighbours are really important. And then the final one is about keep learning. And I think that these sessions are incredibly helpful for me. Last week, hearing about the adult social care pathways and how social care have been able to protect vulnerable people, and also hearing today about the mental health and wellbeing services. So I think it's just fantastic to keep those key messages about these are the evidence-based ways to keep well during these incredibly difficult times.
Thanks, Barry. Yeah.
Thank you, Barry.
And that's something that we've spoken about as well previously, kind of over the past few months. So it was great to see it in the slides. We've time for one more question if anyone has one. We'll move on to next steps. So we'll continue to answer your questions. We had a lot of questions today, which was brilliant. Thank you all. And we will collate those and the responses and send them out on our weekly email on Friday. Our next drop-in session is the 17th of February. So at the same times again, between 12 and 1 and 7 and 8. We ask that you spread the key messages, as Vasa put it so well, particularly around vaccination, and do continue to get in touch with us if you have any questions about anything, or you're hearing something in the community and you're not sure about it. And if you would like to also volunteer to be a case study for either having had your vaccine already or going forward in the next couple of weeks. Thanks everyone for joining us today. A big thank you to Slavek, Debbie and Laura. It was a really interesting session. I think we learned a lot. So big thank you all, and have a lovely afternoon.